Health coverage and the federal marketplace. Open enrollment recently began, and today we're going to be getting some tips about the federal marketplace. Hello and welcome to Comcast Newsmakers. I'm Candace Kelly, and today I'm joined by Jolene Calla. She's the Vice President of Healthcare and Finance and Insurance at the Hospital and Health System Association of Pennsylvania. Thank you so much for being with us today.
Thank you.
Absolutely. Now, this is something in terms of enrolling for insurance, whether it's the federal marketplace or another type of insurance. People get very intimidated, especially the way that this marketplace rolled out years ago. Tell me a little bit about what people should understand to prepare for the best experience.
For the best experience, what you really want to do is you want to be educated. And as good a job as we have done in Pennsylvania on getting people enrolled since the federal marketplace opened in 2013, there's still a lot of work to be done. We have about 1 million people in Pennsylvania who actually would qualify to be covered. And so what part of our goal is today is to help educate them on the resources that are out there, and particularly resources through the hospitals. And something that people probably don't automatically think of is that they can actually get help there. We typically think of hospitals as places you go when you're sick or you need immediate care. However, they also play an important role in helping people get covered.
Because they're counselors, certified counselors who can guide them along the way.
Absolutely. And that is something that the hospitals have and people can use. And those certified counselors can work with you one-on-one. They can help you navigate through websites. They can help you know the right questions to ask for your particular situation. For example, what are my personal needs? Is my doctor in the network? Where do I go to enroll? How do I do my application? They can walk you through all of that one-on-one. However, they can also help you in a group setting if you're more comfortable. There's health fairs, there's educational programs. There's a lot of things that the hospitals do to support this overall effort for Pennsylvania.
What do you see as, I guess, one of the biggest inhibitors for people not coming forward to get health coverage these days? Would it be just the fact that it seems like it's so much to deal with and might be a little bit overwhelming?
I think there's a couple things. That's definitely one. It's a daunting task. I mean, I think anybody even working in health insurance these days has a hard time keeping up with it. So if you're a person who doesn't have insurance and you're trying to get it, it can be very scary to go out there and figure out what you need, where to get it, and how to get the right thing. So that's probably one of the biggest things.
I know that's something you also like to tell people is that they ask family and friends about their experience, and certainly they can find out information about them throughout in terms of the process.
Absolutely. The more information that you can get, the better that you are. And it really comes down to doing your homework, just like anything else. But again, you want to make sure that when you talk to people, you're getting the right information and the correct information. So that's why, as much as you want to talk to family and friends, as a start, you do want to reach out to somebody who you know, or a website that has, certified information on it, where you're getting the correct information, the correct deadlines. Because, if you don't have coverage now in Pennsylvania and elsewhere, there's penalties. And the penalties started last year. They almost double for 2016. So this is a really important topic that you want to make sure people understand and get themselves set up to succeed for.
Absolutely. So before we go, I want to make sure people know if they're on the cusp of saying to themselves, okay, I'm going to go do it. What's their first step? What should they be doing right now to get enrolled?
Go to healthcare.gov, that's the federal marketplace, and there are some very basic first pages on there. When you put that into the website, that will bring up some very simple questions. It'll give you some simple definitions, and you will get correct and accurate information for your particular state. So that's a great place to start.
Okay, great. And hopefully a lot of people will look this and start. I appreciate you being with us today.
Thank you.
All right, good to see you, Jolene Calla. And I'm Candace Kelly for Comcast Newsmakers. Thanks so much for joining us.